Howdy! I'm here to talk to you about the respiratory system today. That's our focus for this month. Is we're focusing on the entire respiratory system in our wellness program. And what's interesting about when we focus on one system at a time is that the systems interact with each other. So we have the system might be interacting with the respiratory system, which is the sinuses, the nasal passages, the sinuses all the way down into the mouth and throat, the trachea that comes down, the bronchioles, the lungs. That also interacts with the musculoskeletal system. So we might have a postural issue that would be contributing to problems in the respiratory system. So a lot of times we think about our heads being forward, but a lot of times it's actually our back, our torso is back, and that a lot of times is tension in the rib cage and the back. So that's one thing that if you're having trouble in the respiratory system is that you could work on muscle tension in the rest of your body, especially the rib cage and the back. So I posted already on my page about some video that Peter has already done with demonstrating that. So we use the OrthoSport massage oil. We call it a massage therapist in the bottle because we're professional massage therapists, but this makes the job really easy and you could do it for yourself at home. So doing massage on the rib cage can help to alleviate pressure that's on the respiratory system, both in the rib cage area, the lungs and the bronchioles, but also up here in the upper respiratory. So today I'm going to talk about the interaction with the fluid system. So we have the respiratory system, but then there's a lot of fluid in the respiratory system. Sorry there. So there's a lot of fluid in there that we have to deal with as well. Now the respiratory system might make its own fluid. I mean, it does with the mucus and everything like that. But then also we have drainage in the ears that we can talk about right now. So we're going to talk about the lymph system and do a lymph routine to help you drain that. And it usually helps all the fluid that's in here. So in the ears, the sinuses, and the lymph as well. So here we go. We're going to start here. We want to make sure that the drains for the lymph system are open. And there's big drains right under here. And that's where most of the lymph actually comes up for the rest of the body and then dumps in. So what you do is you're going to go right over your collarbone right here, come up in here, and just pump. 1, 2, 3, 4, 5. And now I'm not doing a lot of pressure. It's just a little bit, just to kind of get that fluid moving down. That's going to help open the drain. And then what we're going to do is we're going to start low and keep pushing it to the drain. Just like when you're pushing water on a table or on a surface, you're going to keep pushing it and you want to start close to the drain, otherwise you're going to back it up. So you're going to come here. Now it's just like you're doing water, like if you do here, the water's going to go out. So you want to just keep that kind of constant movement. Come back here and do that, and then do the other side. Okay, and then 1, 2, 3, 4, 5. Now we're going to come up here. Especially if you have a lot of fluid, you want to keep doing that, opening that drain. So we're going to do it again on the side of the neck. 1, 2, 3, 4, 5. That's a good number. And again, 1, 2, 3, 4, 5. I can already feel my ears draining. And then 1, 2, 3, 4, 5. Okay, can you hear my voice just changed? Isn't that interesting? Okay, so now, actually I want to open the water wheel. This is the main drain for the head. And so it kind of has a little spirally feel to it. So you kind of get behind the ear and you're just going to go just like that. Kind of a little spiral. Boom. Do that. 1, 2, 3, 4, 5. Now that's not a lot of pressure, but it's you're making good contact, and then just gently twirl it. Okay, and then again we're going to just rinse and repeat. So here we go. Drain, 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 and then 1, 2, 3, 4, 5. Now we're going to start on the face a little bit. We're going to take from here back to the water wheel. So just 1, 2, 3, 4, 5. You can come up from the chin. You can go under the chin, up to the water wheel. And again, 1, 2, 3, 4, 5. To the chin, under the chin. Okay, now we're going to drain. So you come back to the water wheel. 1, 2, 3, 4, 5. Neck, lower neck, neck, lower neck. 1, 2, 3, 4, 5. Okay, now this is where I'm already kind of stuffy. So here we're going to go to this down this side, and then we're going to go up and over. So first one is, again, you're pushing water, so you want to, can you see? I'm trying to get to where you can see how much pressure. It's not very much pressure. I'm not digging in. See, that's a lot of pressure. And I'm not just doing this. I'm going to get a teensy bit of drag on the skin, okay? So there. It really, it's kind of like if you, we think about it as the weight of a nickel on here is where you start to make contact with the lymph. It's not very much. So just here, and then we're going to come down, and again here. Okay, now we're going to go up and over the ear. Okay, do the other side. And up and over the ear. I can feel my nose start to clear. Okay, I need to do my water wheel, so I can feel it clogging. 1, 2, 3, 4, 5. Again, down the neck, and open the drain. 1, 2, 3, 4, 5. Okay, let's do this upper. So we're going to come here across the forehead and back behind. So here, remember, we're pushing water. Now there's sinuses under here. So we're not really pushing hard enough to get the sinuses pressure. We want to just get the lymph moving. And then we're going to trust that that's going to help. You know, once the water gets moving, the fluid just tends to move. So just trust the process here. And again, down and here. So totally forgot to add. I'm doing this dry, but you can add, I brought my roll-on, forgot to use it. So this is Breathe Again roll-on. I don't know, is it upside down? Whatever, it's Breathe Again roll-on. Okay, so this is an essential oil blend. It's got lots of amazing eucalyptus oils. I looked at the ingredients and they're really fun. You can't get them in single oils. And so it's already diluted, so it's easy to use on the go, and it's got this little point here, or this ball. I love to use this for like acupressure. So especially when, you know, things are stuffy in here, you can come along here and go, ah, you know, just kind of lean into the ball, do a little spiral, go along there. And then you're also getting the benefit of that it's gonna provide the oil to kind of lubricate your massage. Oh, and I can smell those vapors. They're awesome. Okay, this feels good. I should do this more often. Okay, you can do that up here as well. You're probably not gonna push as hard. Just kind of roll it all along. Okay, the temples, oh, a little massage. Okay, so then we can finish up with repeating on these sinus areas. So, and there, drain, do this, and drain. Okay, open the water wheel, and then I'm feeling it like it needs to come under here. And drain. 1, 2, 3, 4, 5. Okay, that's how you do it. Sometimes it takes more than one if you're really stuffy up here, but if you kind of keep this as if that's an issue for you, if you just keep doing it on a daily basis or a couple times a day if you're really having an issue, then that can really help you keep the fluid moving. You can do it on your kids. I don't know if I could get one of my kids to cooperate and I could do a demo on them. I might have to do that, like do a video and not do it live. I'm just seeing this question, would this work for draining the middle ear? I think that it probably would. Again, as you get the fluid moving, it it moves. So it's one of those things, if it's really clogged and congested, then you might just have to do it more, do it more often. So if you're dealing with that actively, then I would probably get my roll-on out, lubricate it here, right back here, and then, every hour, every half hour, come and just do this water wheel and drain, and see if that helps. It's one of those things. Generally, when we're working professionally, you see the fluid start moving. The client can feel the fluid start moving. So it's definitely a good tool. So thanks for joining me, and I hope that's helpful.